Hi, I'm Dr. John Neustadt, President and founder of Nutritional Biochemistry Incorporated, NBI, and I want to talk to you today about the gut. And specifically, I want to talk to you about acid-blocking medications. These are very popular medications. They're now available over the counter without a prescription under the names such as Prilosec, Protonix, Zantac. You may have heard of it as the little purple pill, one of the acid-blocking medications. And these are used and FDA approved to treat the symptoms of acid reflux, also known as gastroesophageal reflux disorder. And those symptoms can include feeling of acid or burning in the chest when you lay down, a dry cough when you lay down. You can feel some burning in your stomach, in the back of the throat. And those medications are incredibly effective at suppressing acid production in the stomach. But unfortunately, taken long term, they also are having some very dangerous side effects that people are becoming more and more aware of. And I want to make sure that you know about them because millions and millions of people are on these medications for years and years, and they think they're safe, but the reality is the FDA never approved them for any more than a couple of months at a time. And yet again, people are taking them for years. Research just came out, another study showing the dangerous side effects of these drugs, and that is that they actually can increase the risk of stomach cancer. This builds upon previous research showing an association with taking these medications and an increased risk of dementia, and a previous study showing that over a period of years, taking those medications can actually increase your risk for osteoporosis hip fracture by up to 60%. Now, the problem is that for many of these people, they don't need these medications, but they're not learning about the important role that acid can play, why they need acid in their stomach, and the harm that it's doing when they block that acid, and also what they can do for the symptoms that they're experiencing. Now, don't get me wrong. Some people should be on these medications, and that conversation of whether or not you should be is best had with your healthcare provider. But please understand that simple dietary changes for many people can get rid of those symptoms. The most common foods to cause acid reflux are tomatoes, raw garlic, raw onions, citrus, and I'm sorry, chocolate. So just doing a little experiment and getting those out of your diet and seeing if you feel better can help a lot. An infection can cause it. The H. pylori infection in the stomach can cause acid reflux. So getting tested for that and ruling that out, that may be an important approach, because if that gets treated, the acid reflux can go away. Acid plays a very important role in the body. It sterilizes food as it passes through the mouth and into the gut, so we don't get infections. It reduces the risk of infections. It also activates enzymes required to break down the food and required to access the nutrients stored in food to get into our bodies so we can actually use them. And acid plays another important role that a lot of people aren't aware of, and that is that it's the signal to, there's a tiny little muscle at the bottom of the esophagus. The esophagus is the tube that goes from the mouth to the stomach. And when food goes down into your stomach, there's a small little muscle at the bottom of that tube, the bottom of the esophagus, that closes. And it keeps the acid from going back up into the throat and burning you. The signal for that muscle to close is acid. So if your body isn't actually producing enough acid, that little muscle can stay open and you can get acid going back up into the esophagus and burning the back of the throat and causing those symptoms. So paradoxically, or surprisingly, the problem that some people may be having in experiencing acid reflux is that they actually aren't producing enough acid. And the risk for that goes up. So that when you get into your 60s or higher, that the risk for having reduced acid production actually is climbing as we get older. And so that could be the underlying cause and the underlying problem of what's going on. There's some tests that can be run to test for that, or you can do a trial of just supplementing with a little bit of acid when you eat to see if that takes care of it or reduces the symptoms. Now, I don't recommend that without being under the care of a healthcare provider and under supervision, because there are some instances where supplementing with hydrochloric acid capsules is not indicated. It's important not to do, and there's a way to do them safely to test that, or there are actually medical tests that can be run to see if you're not producing enough acid. The bottom line is medications are prescribed so easily in this country, in the conventional healthcare system. And just taking some time to understand how the body actually works, the underlying physiology, and working with that, understanding the importance of stomach acid, for example, and the crucial role it plays in regulating digestion, in regulating the control of that muscle at the bottom of the esophagus, can provide better information for actually identifying and potentially treating the underlying cause, so that people perhaps don't have to be on these medications long term, which now we know can increase your risk of stomach cancer, may increase your risk of dementia, and has been shown to increase the risk of hip fractures. So find a doctor who can work with you on that, who understands integrative medicine, who understands nutritional medicine. You can take this to them and show it to them so that they can become educated. There are a lot of resources out there. Continue to learn yourself. Head on over to NBIHealth.com to learn whatever resources we have for you, more information and products to help you and your family improve your health. Make sure you like this Facebook Live page and see us Facebook Live. See me here next week. I'll be here next week again with another Facebook Live video, and I hope you have an amazing day and an amazing week. Bye-bye.